Welcome to EazyMed, where we make complex medical concepts simple and easy to understand. In today's video, we'll be talking about Lyme's disease, its cause, symptoms, diagnosis, treatment, and prevention. So let's get started. Now let's talk about what exactly Lyme disease is. Lyme disease is a spirochetal infection caused by Borrelia burgdorferi and transmitted through the bite of an infected deer tick. It was first identified in 1975 in Lyme, Connecticut, and that's where it gets its name from. The tick usually feeds on animals such as mice, dogs, cats, cows, horses, deer, and even humans. Interestingly, wild animals don't show the illness, but domestic animals can develop clinical Lyme disease. The peak season for human infection is during the summer months. Now let's discuss the early symptoms of Lyme disease. The most characteristic feature of early infection is erythema migrans, EM, a skin lesion, also known as the bullseye rash. This rash appears in about 70 to 80% of infected people, usually 3 to 30 days after the tick bite. It starts as a red macule or papule and gradually expands to form a large circular lesion, up to 12 inches wide, with a bright red border and central clearing. Along with the rash, patients may experience flu-like symptoms such as low-grade fever, chills, headache, stiff neck, fatigue, swollen lymph nodes, migratory joint and muscle pain. These symptoms generally appear within a week after infection. Now let's move on and talk about what happens if Lyme disease is left untreated. The bacteria can spread within weeks or months to the heart, joints, and central nervous system, CNS. This can lead to carditis, chronic arthritic pain, and swelling, especially in large joints, and neurological problems like severe headaches or poor motor coordination. Now let's talk about how Lyme disease is diagnosed. The first step is the enzyme immunoassay, EIA test, which gives positive results for most infected individuals. If the EIA test is positive or inconclusive, a Western blot test is performed to confirm the diagnosis. Let's now discuss the treatment of Lyme disease. Early-stage Lyme disease can be effectively treated with antibiotics such as doxycycline, vibromycin, cefuroxime, Ceftin, amoxicillin. Doxycycline can also help prevent Lyme disease when given within 3 days after a tick bite. Usually, a 2 to 3 week course of therapy is effective for solitary erythema migrans. However, patients with neurological or cardiac complications may need IV therapy with ceftriaxone, rocephin, or penicillin. Now let's finally talk about how we can prevent Lyme disease. Discourage deer, the main source of food for adult ticks, from entering your area. Wear long pants and tightly woven, light-colored clothing so ticks can be spotted easily. Tuck your pants into socks, wear long-sleeve shirts, and always use closed shoes when hiking. Apply insect repellent containing DEET on skin or permethrin on boots and clothing. Remove attached ticks with tweezers, grasping the mouthparts close to the skin and pulling straight out. Avoid twisting or jerking. Don't use folk remedies like nail polish or petroleum jelly. Save the tick in a small bottle of alcohol for later identification if needed. Wash the bite area with soap and water, apply antiseptic, and wash your hands thoroughly. And that's all for today's video on Lyme's disease. If you found this video helpful, don't forget to like, share, and subscribe to EazyMed for more simple and clear medical explanations.